I'm now talking with Dr. Kanwar Rana. He is the medical director of the psychiatry department at the Community Health Center of Branch County. Doctor, welcome to the show.
Thank you, Dean.
Today we're going to talk about May being Mental Health Month, and there's a lot of different people that are afflicted with various problems out there, and so we thought we'd bring Dr. Rana in. We also have John Bolton from Pines Behavioral Health Services with us today, and we're also going to talk with him about some of the services that are offered throughout the community. And Doctor, let's just start with yourself. Give me a little background on you.
I've been in psychiatry for many years, really 20, 30 years. I did my residency in United Kingdom in various cities like Birmingham and here in London. And then I came here in the US. I did some internship in New York City. And then I've been interested, in psychiatry. Since then, I was in Kalamazoo State Hospital as a staff psychiatrist. And then I've been working in the state system for a correctional mental health program. I was in Huron Valley Center. Then I've been involved in this hospital for many years, I think 10 to 12 years. Mm-hmm. And I've been then, enjoying this medical directorship for the last 1 year.
Well, so really what you're talking about is experience. You've been kind of around the block and seen a lot of different things happen.
That's right. That's correct. All kind of illnesses, various degrees, even internationally.
Mm-hmm.
Yes.
Now does, and this may be not the right question, but does mental health illness, is it different from one country to the other, or is it just different from person to person?
It's the studies we've done, the mental illness is just like any other illness, like hypertension, that is prevalent in all over the globe.
Okay.
Yes.
Talk to me about what mental illness is.
A mental illness is where you have a disorder of mood, thought, emotions, and more so nowadays that this impairs our function, that we're not able to function. Just like a blood pressure, when it's high or very low, we're not able to function.
Mm-hmm. And this is something that people have a problem really kind of controlling themselves or getting out of that, that depression and that mood. It's not something they can just say, hey, that's it, I'm not depressed anymore.
Yeah, that's right. In the past there was some sort of a stigma that, difficult to admit that we have problem. And then, of course, problem people have with even blood pressure and seeking treatment for that. But for mental illness, there's more problem that people don't feel that, how others will look at it, how others will look down on you, or so people will avoid you, so they're reluctant to come for services. But this is really where we have treatment, we have therapies, we can get all this treatment in check, and you go back to functioning again.
And all confidential, too.
And this is all confidential. That's true.
Well, I think sometimes that you need someone to talk to, and in some cases, maybe some medication. What are some of the different treatment options that people would have?
Sure. We have mental illnesses are a variety of illnesses. So there's a anxiety disorder, there's a depressive disorder, there's a mood disorder, there's psychosis. So medications are geared towards all different illnesses. And for anxiety, we have benzodiazepines, antidepressants. For depressive illnesses, we have antidepressant medications, such as we may have heard the names, such as Prozac, Zoloft, Celexa. We also have like bipolar disorder. We have mood stabilizers such as lithium, which has been going on since 1950s. We also have like Depakote, Tegretol, and other new medications such as Abilify, Geodon, or Zyprexa. We also have psychosis, which are treated with Zyprexa, Abilify, and Geodon.
Dr. Rana, you mentioned in your statement there, you mentioned bipolar, and I would think that that's something that a lot of people, are familiar with, and that's really a high and a low, isn't it?
That's true. Bipolar illness previously was called manic depressive illness, but bipolar illness basically means that you're having very severe depression. You're also having a opposite of depression, which is like manic episodes. But we do have great treatment nowadays. We have mood stabilizers. We have medication to control this thinking and these processes which are running very fast, or they are changing, or mood swings are there. So we have all the treatment for those mood disorder and bipolar disorder, yes.
Now, do I just come and see you, the doctor, or is there a team that would work with me?
Yes. The initial assessment is done. which will be seeing the psychiatrist, also seeing the psychotherapist, which will be social worker or psychologist, going through group therapies, going through activity therapy, going through occupational therapy, going through psychoeducation, group therapy processes. And we all work together as a multidisciplinary team, and we come to an individual treatment plan.
So it's not just one person.
No.
I'm working with a whole team that can
Yes.
kind of dissect the problem that I'm having.
That's true, because people are having all kind of problems. Mental illness affects your functioning in different areas, marital areas, your personal areas, your work environment. You're not able to relate to others.
And I know that you also work with Pines Behavioral Health Services, don't you?
That's correct, because once we discharge patients, they are seen in outpatient setting, and we're fortunate that Pines Behavioral Health is here to provide those services.
Doctor, thanks for being with us.
Thank you for being here.
All right. Dr. Rana has been with us. He is the medical director of the psychiatry department at the Community Health Center of Branch County. We're going to take a quick break. When we come back, we've got John Bolton. He is the director of Pines Behavioral Health Services. Stay with us. You're watching Our Community.